I believe Dr. Swati Maheshwari is back with us now on the broadcast. Dr. Maheshwari, if you're able to hear me, I was trying to get you in here earlier on this latest spike, how serious it is according to you, and what you attribute, the numbers rising in certain parts of the country as well as the fatalities too.
Well, if you see the present situation, then one good thing is that a lot of genomic sequencing is happening right now. And ICMR recently released the data as well, stating that there are 4 subvariants of Omicron, which are attributing to the case rise that we are seeing right now. And all these 4 variants, which are subvariants of Omicron, they have high transmissibility. So definitely what we are seeing right now is that, more and more people are getting in touch with each other and the cases are rising. But the good factor is that it is not that severe infection. And as we see cases in OPD also, and the kind of cases that are coming right now, what we see is more of upper respiratory tract infection, which is generally mild. So we are not seeing cases of lower respiratory tract infection or pneumonia, which actually get serious and people start requiring hospitalization and ICU care and all that stuff. So as of now, the cases are quite limited, self-limited cases, which are getting recovering by themselves. So they just need little supportive treatment as of now. So that is the good thing that we are seeing right now. And even if you look at WHO, they have also stated that we are still considering it, despite the cases that are rising in a lot of other countries as well. They've considered it as a variant of monitoring and not variant of concern yet. So what we are seeing around is that it is a milder version. It is not a severe version. Definitely some cases, like you mentioned, that we have seen an uptick in the death cases as well. But then again, that is attributable to the fact that a lot of people have comorbidities and their immunity wanes over the time. And whenever a new virus comes in, they evade through the immunity. And people who are vulnerable, they kind of succumb either to the infection or they land in ICUs, because for them it becomes a serious infection. So that is the special kind of population that we need to safeguard. And most of the panelists here have raised concerns, especially for them, that this is a vulnerable population and we need to safeguard them. That's why people who are stepping out of their house, even if they are young, even if they have good immunity, they need to use masks. They need to do hand hygiene so that they don't bring the infection back home, where you might be having your elderlies, your children, and those are the ones who are vulnerable. So it is the onus on the people who are going more out, who are mixing with other people's. So please see that you use your mask, especially in poorly ventilated areas, especially when you are in crowded areas. Also, you need to follow hand hygiene. As over the years we have been talking about it and everybody knows what to do. It's only that we see a lot of complacent behavior right now. People are not taking it that seriously, but it should be taken seriously, because precaution is something that easily can avert big problems, and that is what we should be focusing on right now. So if people are more cautious, if people follow all these protocols, then definitely we won't have those high surge that we have seen in the past, and definitely we'll be able to ride through this surge that we have seen right now.